Many of you might know that vitamin D plays an essential role in bone and cartilage metabolism. Still, more recently, researchers found that vitamin D can actually influence our immune system and might be a vital link in our understanding of autoimmune diseases. In this video, I will discuss what is vitamin D, what is the connection between vitamin D and the immune system, can vitamin D deficiency cause autoimmune diseases, can vitamin D supplements prevent rheumatoid arthritis or autoimmune diseases, and can vitamin D be found in foods? This is the last video of the mini-series that included valuable information about supplements used by patients with arthritis. I would invite you to check out my previous lectures where I talk about collagen, glucosamine, chondroitin, turmeric, and also fish oil.
rheumatologistoncall.com.
Hi, I'm Dr. Gurnita, the founder of Rheumatologist on Call. In this YouTube channel, I educate people about arthritis, autoimmune diseases, and the best ways that you can use to live better with arthritis. If you're new here, welcome. Don't forget to subscribe. But if you have been following the channel for a while, I'm very excited to have you here and share more information with you. What is vitamin D? For many years, vitamin D was known as the hormone regulating calcium, magnesium, and phosphate absorption in the small intestine. In this way, vitamin D was directly involved in maintaining strong and healthy bones. However, in time, vitamin D was shown to have many other biological effects, like antioxidant, neuroprotective, involved in muscle function, and more recently, vitamin D was shown to have anti-inflammatory properties. What is the connection between vitamin D and the immune system? It was recently discovered that vitamin D has some receptors on the immune system cells. These receptors, called VDR, from vitamin D receptors, they are essentially found on nearly all immune system cells, either innate or adaptive immune cells. In this way, vitamin D can modulate the function of T cells and decrease the production of pro-inflammatory cytokines like interferon gamma or TNF-alpha. Vitamin D receptors can also be found on cells present in our joints, like chondrocytes or synoviocytes. Vitamin D receptors can also be found in the cells present in our joints. Some studies suggest that the active form of vitamin D, D3, acts by reducing the activation of our acquired immune system. Therefore, vitamin D deficiency theoretically can lead to autoimmune disease or can increase the risk of autoimmune diseases, which was reported actually in animal models. In humans, vitamin D deficiency was associated actually with type 1 diabetes, multiple sclerosis, and actually inflammatory bowel diseases. Can vitamin D deficiency cause arthritis? In 1996, some studies showed that a low level of vitamin D was associated with an increased risk in rapid osteoarthritis progression. However, later in 2007, there were other studies that actually found no association between the worsening of osteoarthritis and deficiency of vitamin D. Can vitamin D supplements prevent autoimmune diseases? Now, let me talk to you about vitamin D and rheumatoid arthritis. One study that followed about 20,000 females over a period of 11 years showed that those females that had a higher vitamin D intake had a decreased risk in developing rheumatoid arthritis. Those females were over 50 years old. Now I would like to introduce you to a fascinating study that was just published this year in 2022. It is called the VITAL study. The original VITAL study was a randomized, double-blinded, placebo-controlled trials of 25,000 people that looked at the effect of vitamin D and omega-3 fatty acid supplementation on different types of cancers and cardiovascular disease. After a median follow-up of about 5.3 years, researchers found the following results. In patients who were randomized to receive vitamin D, it was a 22% reduction in the risk of developing autoimmune diseases. In the group that took fish oil, it was 15% reduction, but this one did not reach statistical significance. Even though there was a reduction, it wasn't big enough for the researchers to be sure that this isn't caused actually by chance. But the study did find evidence of an increased effect of omega-3 fatty acid supplementation after a longer duration of time. These results are actually amazing as they fit real life. When I check vitamin D level in my patients with autoimmune diseases, the level is usually low. The same for omega-3 unless the patient is using a supplement already. To reduce the risk of autoimmune diseases in people over the age of 50, it is recommended to use 2,000 international units of vitamin D and 1,000 milligrams per day of marine omega-3 fatty acids or fish oil. These doses were used in this VITAL trial. Can you find vitamin D in foods? The major natural source of vitamin D is synthesis of vitamin D3 or cholecalciferol in the lower layers of your skin after the skin is exposed to UV light. However, many people these days avoid the sun due to increased risk of skin cancers, or they will apply sunscreen that will block the UV light, and in this way, the vitamin D synthesis is decreased. Only a few foods, such as fatty fish, naturally contain vitamin D. In the US and other countries, cow's milk, plant-derived milk, and cereals are fortified with vitamin D. Mushrooms exposed to ultraviolet light may also contain vitamin D2. In summary, before you start any supplements, I do advise you to discuss your clinical situation with a physician that will be able to review the risk and benefits of taking a supplement. As I said before, supplements can be dangerous, and in some cases they could change the way that other medications are absorbed. This is just an educational lecture and is not supposed to provide you with medical advice. This video will conclude my mini-series about the most common used supplements in patients with arthritis. I hope you find this information valuable and you can share it with other people. If you like the educational content of these videos, don't forget to like, share, and subscribe to my channel. Have a wonderful day, and I'll see you soon when we're going to talk about many other subjects regarding arthritis and autoimmune diseases.
rheumatologistoncall.com